Hi everyone, I'm Dr. Teo Cheng Rong, the anchor doctor in Healthway Medical, Limbang. My special interests are in family medicine. I like to see a varied kind of cases ranging from pediatric patients and adult patients with chronic conditions such as diabetes, hypertension, and high cholesterol. Some of the conditions I treat tend to be common conditions such as respiratory infections, cough, cold, runny nose. Sometimes I do see interesting cases, for example with thyroid problems, with more complicated endocrine problems such as diabetes, as well as geriatric patients with more problems. I wish to be a doctor because I wanted to have a meaningful career whereby I can help others, and I like to have a job with good human interactions. In the future, I hope that I could be a good family physician to my patients and grow old with them. One of the most challenging moments when I was a junior doctor was in National University Hospital when I have to attend to the CPR, which is to do chest compressions on a less than 1-year-old baby who has Down syndrome. And it was that moment whereby I was pressing on the child's baby and there was actually blood spurting out from the mouth and the nose. So it was quite a bloody experience. But what struck me most was the fragility of life. And when I went down to the blood bank to collect the blood transfusion for the baby, I received the call that the blood was no longer needed. So the baby has actually passed on. So it was a very emotional moment in my life at that point in time. And I actually cried. And that was how I coped with it. So I realized as humans, as doctors, we are also humans. So it is sometimes good to express your feelings and expressions and go through the experiences that I have with my patients, whether it's good or bad. And that helps to nurture us as better doctors and better mentors. There are many proud moments in my life as being a doctor. So the proudest moment this year for me was when patients in Limbang Shopping Centre could actually recognize me and actually call by my name and update me about their medical conditions when I were out for lunch or dinner. So it was very, very satisfying. I have 2 quotes I live by being a doctor. The first is to do no harm to my patients. I try my utmost best to help them improve their lives, and most importantly, not trying to harm them. The second being, I like to be a listening ear. I always like to listen to your problems, be it medical or non-medical. So it could be some stress in your family, in your life. As long as you want to tell me, I'm always there to listen.